When it comes to the significant topic of maternal health and the treatment options available during pregnancy, a recent development is stirring up some intense debate. The U.S. Department of Health and Human Services issued a new guideline advising expectant mothers to steer clear of acetaminophen, also known as paracetamol in the UK and the primary component of Tylenol. This recommendation stems from concerns that its use may elevate the chances of autism in unborn children. However, the reality is that millions of mothers have relied on paracetamol for managing pain and fever safely during their pregnancies, believing it to be one of the few medications they could use without risk. This is a dramatic shift from what we have been told for decades, and it raises many eyebrows. The reasoning behind the updated warning regarding Tylenol is anchored in a systematic review conducted by Dr. Andrea Baccarelli, the Dean of Public Health at Harvard University. This review claims to have found a strong, consistent association between prenatal exposure to acetaminophen and conditions such as ADHD, autism spectrum disorders, and other neurodevelopmental disorders. Dr. Baccarelli's team asserts that their findings remained robust, even when accounting for various confounding factors, and employed rigorous methodologies. Yet, here's where it gets controversial. Many of these methods have been scrutinized for their reliability, and notably, the review appears to overlook significant evidence that counters its conclusions. One of the critical shortcomings of this review is that the authors were aware of compelling evidence from sibling control studies, where researchers examined children who have been exposed to Tylenol in utero against their siblings who were not. Surprisingly, these studies, deemed among the most reliable, did not reveal any alarming connections between Tylenol and adverse developmental outcomes. Why, one might wonder, would the authors be so eager to discredit these well-founded studies? Could it be that those findings didn't align with their preferred narrative? In fact, the most comprehensive and highest quality study in this domain analyzed nearly 2.5 million births in Sweden from 1995 to 2019. Utilizing precise measurements of Tylenol exposure in a country where usage is predominantly through prescriptions. The results mirrored those from other studies. Mothers taking Tylenol during pregnancy were more frequently associated with children diagnosed with autism or other neurodevelopmental disorders. However, this pivotal research also analyzed sibling dynamics and demonstrated that the child exposed to Tylenol bore no greater risk of developing any disorder relative to their unexposed sibling. This crucial evidence suggests that the correlation established is not indicative of causation at all. Unfortunately, the review is riddled with logical missteps and inaccurately presented evidence. It has been criticized for treating weak findings as strong conclusions, failing to properly synthesize various studies, and even making errors in how studies were cited. Essentially, it appears that the review was more carelessly constructed than scholarly robust, supporting a narrative many people are eager to accept, that Tylenol could potentially cause autism. Consequently, in the grief of misunderstanding backed by seemingly credible sources, countless pregnant women may feel anxious about using Tylenol or any other paracetamol brand, despite its well-documented efficacy when needed. For mothers trying to manage pain or reduce fever, they face a troubling lack of alternatives. Opioids are not suitable, and ibuprofen is often deemed unsafe, especially in the earlier stages of pregnancy. If it were indeed proven that Tylenol poses a risk of causing autism, then an honest discussion about its pros and cons for pregnant women might be warranted. However, the current scientific consensus overwhelmingly indicates that Tylenol does not induce autism. When public health institutions misinterpret scientific inquiries like this, the consequences can be severe, often leading to unnecessary worry and potential harm. So, who will advocate for these mothers caught in this web of misinformation? What are your thoughts on the recent warnings about Tylenol? Do you believe there is sufficient evidence to support such drastic claims? Let's open up this important conversation.